The typical older adult starts around age 65. Women are perceived older at around age 60, whereas men are perceived older around 65. Women typically live longer than men. This is a time for transition into new lifestyles. They have more leisure time, improve relationships, and readjusting to new responsibilities. Most older adults live in single family homes. However, some do live in their family homes, assisted living, senior community apartments, and long term care facilities.
Spiritual values and beliefs are as diverse as the individuals themselves. Because there is such a vast difference between each older adult's spirituality, it can pose a threat on the nurse's ability to understand the client's spirituality. Therefore, nurses should try to ask open-ended questions such as, what is your perception of a higher being and spirituality? These questions can help encourage discussion that can give the nurse a better insight into the patient's spirituality. Many older adults enjoy reminiscing or recalling the past. This is a tool older adults like to use in order to bring up meaningful experiences to help understand the present and find ways to resolve current conflicts. This is a therapy that could be done one-on-one with the nurse or encouraged between other older adults. Every single older adult, healthy or not, needs to be able to express their sexual feelings. These feelings include love, warmth, sharing, and touching. Sexual feelings are not solely contained to intercourse. Because of this, as a nurse, you should be open to providing privacy to the patient for any needs to discuss their sexual health, as well as maintaining a non-judgmental attitude. It is very important not to ignore the need for older adults to touch and be touched. This could be as simple as holding a hand while comforting a patient or giving a quick back rub before bed. There are many older adults who are deprived of touch due to the fact that they might be separated from family and friends. An example of this might be an older adult in a long-term care facility. A study done in 2006 showed that agitation levels were increased in demented adults who had not had healthcare providers use touch as a healing intervention. Touch can provide the patient with some sensory stimulation, increased relaxation, physical and emotional comfort, orientation to reality, warmth, and lastly, it can communicate interest.
End-of-life issues is a common theme among older adults. Loss is also another common theme. Loss of loved ones, loss of body function, and mobility. Advance directive legal documents of what the person wants to happen to them in the event of a medical emergency is something most adults need to have. Finalizing plans for burial and ceremony can help relieve some fear and anxiety of death for the older adult.
According to estimates, the number of older adults will increase to 72.1 million by 2030. Factors that contribute to the projected increase in the number of older adults are the aging of the baby boom generation and the growth of the population segment over 85. In 2008, minorities, African Americans, Hispanics, Asians, American Indians, Eskimo, Aleuts, and other Pacific Islanders made up 19.6% of the population over age 65. Nurses need to take the cultural, ethnic, and racial diversity represented by these numbers into account as they care for older adults from these groups. The challenge is to gain new knowledge and skills to provide culturally sensitive and linguistically appropriate care. In the past, institutional settings such as hospitals and nursing centers often treated older adults as objects rather than independent, dignified people. The time has come for nurses to recognize and address ageism by questioning prevailing negative attitudes and stereotypes and reinforcing the realities of aging as they care for older adults in all care settings. Nurses' attitudes come from personal experiences with older adults, education, employment experiences, and attitudes of coworkers and employing institutions. Given the increasing number of older adults in healthcare settings, forming positive attitudes toward them and gaining specialized knowledge about aging and their healthcare needs are priorities for all nurses. Positive attitudes are based in part on a realistic portrayal of the characteristics and healthcare needs of older adults. It is critical for you to learn to respect older adults and actively involve them in care decisions and activities. How older adults adjust to the changes of aging is highly individualized. For some, adaptation and adjustment are relatively easy. For others, coping with aging changes requires the assistance of family, friends, and healthcare professionals. Be sensitive to the effect of losses on older adults and their families, and be prepared to offer support. Keeping all of these facts in mind, and the older adult population creates a unique care setting for the modern nurse. Not only does the nurse need to evaluate their personal attitudes of the older adult, they need to take into consideration the personal attitudes and feelings about ethnic and cultural diversity. The older adult population is made up of many unique individuals. The population is made up of men and women with varying ethnic and cultural backgrounds. This makes it even more important for the modern nurse to be educated in several areas so that the nurse is not clouded by personal views or biases that might impair their care plans for the older adult.
Some healthcare providers claim that because of their age, activities pertaining to prophylactic measures, health and wellness maintenance will not be helpful to elderly people. Healthcare personnel's personal belief that elderly people have a poor understanding and learning ability has been an important obstacle in providing elderly people with an effective education. The myths about aging have regarded elder people as unproductive, resistant to change, impotent, and stereotyped individuals. In addition, healthcare personnel's lack of knowledge and skills may often prevent them from seeing all behavioral symptoms. For instance, behaviors of an elderly person who suffers from a mental disorder due to dementia can be seen as manipulative, or an older person with impaired hearing may respond inappropriately. In these situations, elderly people are considered difficult or complicated by health service providers. Elderly people's values and beliefs can be a facilitator or obstacle in caring for their health. For instance, elderly adult symptoms such as tiredness or depression are not taken seriously, requiring medical aid, and are regarded as an inevitable part of old age. Due to all of this, a provider needs to consider the following: the patient and family's perspective on death and dying, the patient and family's perspective on health and suffering, the patient and family's acceptance of Western health care practices and their use of alternative traditional practices, and the role of spiritual and religious beliefs in practice.
Physiologic changes associated with aging make older adults very vulnerable. An older adult's mobility is an important area of concern for the family, caretakers, and nurses. Mobility is crucial to maintain good health, and if the older adult is not able to move for themselves, someone else will need to intervene. Encouraging the patient to ambulate is a good way for the family and nurses to promote mobility. Setting short, realistic goals for an older adult can be motivating and give a feeling of accomplishment when the goal is met. If the older adult is dependent on family or nurses to provide mobility, then passive range of motion can be integrated into care in order to maintain muscle strength and good circulation to the extremities. Compression hose can also be worn at home or in long-term and acute healthcare facilities to increase venous blood return from the heart and decrease the risk of developing a thrombosis for an older adult with decreased mobility. Safety is also a vital factor to consider while caring for an older adult. Families should remove throw rugs from the patient's house, shoes should be fitted properly, and walking areas should be free from clutter. Families and nurses should put a non-slip bath mat in the shower, as well as the use of handbars to hold while entering the shower. Implementing these safety tips can reduce the risk of falls in an older adult. Since older adults experience a decrease in sensory and cognitive abilities, drug safety is imperative. Oftentimes, many drugs are prescribed and it can be easy to accidentally misuse them. Families and nurses could suggest using a pill dispenser to organize the medications by separating them for each day of the week. Using alarms to indicate when it is time to take prescribed medications can help eliminate forgetful errors.
In Healthy People 2020, nutrition was identified as a priority area of health promotion for people of all ages. Similar to patterns among other age groups, poor nutrition in the elderly population is common. An inappropriate diet is related to constipation, dental disease, physical inactivity, and depression. Normal physiological changes related to aging affect nutritional status. Fewer calories taken in may result in decreased intake of essential nutrients. A diminished sense of smell may reduce the enjoyment of eating. Gastrointestinal changes can interfere with the absorption of vitamin B12 and folic acid, thus leading to anemia. A diminished thirst sensation may lead to dehydration. Other factors that can affect the nutritional status of the elderly are income, functional status, taking multiple medications, social isolation, lack of transportation, and dependence on others for grocery shopping and cooking. There are nutritional checklists used to assess for warning signs and risk factors of poor nutritional health. The checklists allow for healthcare providers, patients, and members of the family to assess the patient's level of nutrition in order to determine what factors need improvement to promote healthy nutritional intake, mental and physical health status, as well as overall sense of well-being. Physical activity is beneficial for the health of people of all ages, including older adults. Although there are various types of exercise, walking is one of the best forms and it is free. Many older adults engage in walking, swimming, dancing, yoga, and Tai Chi for exercise. Regular exercise improves functional status, reduces blood pressure and cholesterol, decreases insulin resistance, prevents obesity, strengthens bones, and reduces falls. Despite known benefits of exercise, 2/3 of adults between 65 and 75 years of age are inactive. Barriers to exercise that have been identified in older adults include lack of access to safe areas to exercise, pain, fatigue, and impairment of sensory function and mobility. Proposed Objective PAF 6 of Healthy People 2020 recommends that the healthcare providers work to increase the population of adults who meet current federal activity guidelines for aerobic physical activity and for muscle strength training. Nurses may help older adults accomplish this goal by assessing their understanding of the benefits of exercise. Nurses should also educate, encourage, and assist older adults with exercise. When applicable, anti-inflammatory medications may be administered before physical activity to address accompanied pain and help improve the function of the exercise.